Dr. Jason Pozner for the Plastic Surgery Channel, and welcome to No Spin Live. We have two wonderful plastic surgeons on, two very close friends of mine. Dustin Reed from Austin, Texas. Hi, Dustin.
Also sunny Austin, Texas.
What's the temp there?
Today it's a little cool. I think it's in the 60s, but we've been in the 70s the last few days.
Wow. Florida's like in Boca, it's been like 80. And we have Dr. Dan Del Vecchio, one of my really good friends from Boston. Are you home these days?
Home in Boston, 3 inches of snow. Gross. Welcome.
Dan, I haven't seen you in so long. You know, Dan works in my office every once in a while. You haven't been here for a while. Come on.
I gotta come down. I got cases.
This is the time. Come down and visit. We'll hook you up. All right, so we have our format today. We're going to show you both a case, and we're going to really kind of just figure out what you do for this case. And I picked this one specifically for Dan. So Dan, this is a 63-year-old woman, super smart, had a previous abdominoplasty, has like no excess fat, and she doesn't like the wrinkles on her lower buttocks. Okay, so she comes to me, and I actually operated on her, but what would you do? So let's start with Dan, since you're the butt guy. Like, what would you do? She's a nice lady. She's smart. She gets it. She doesn't have much volume that you can place in her, but she hates that saggy stuff at the bottom.
Well, Jason, fat's out, but I think there are two options. One are implants, and the other is to temporize her maybe a year, because there are a couple of off-the-shelf fillers that are being trialed in Europe that are derived from plant-based materials, cellulose specifically, that could be good options for patients like this, where you could simply just inject fat in the lower pole, inject the material in the lower pole, and it acts as a scaffold for fat cells to grow into it. Other than that, I probably wouldn't offer her anything. Implants are going to be a problem because she's going to have inadequate soft tissue, and she probably won't tolerate them well. So I would simply temporize her, have her come back in a year.
Okay, Dustin?
Well, you said that her problem is that what she doesn't like is that it's wrinkled, not necessarily that it's too small, right? I mean, this is the sort of person I'd have to figure out exactly what they want.
She doesn't want a big butt. I mean,
it seems like she's a kind of like a weight loss person who, if she'd already had the tummy tuck, I might just complete that into a circumferential body lift and lift that tissue up if I could.
Right.
I would have to feel evidence.
Just one thing I noticed, she had a previous inner thigh lift. So I'll give you that. I forgot to mention that.
Okay. I still think that would be my plan. I don't have the ability to volumize this buttock with no fat.
So I'll tell you what I did, because, you know, I had an older plastic surgeon working with me for a number of years. So, you know, pre-lipo, pre-fat grafting, they did excisional surgery. So I actually did an excision. I took it up. I'll have to draw it on here for the final filming. But I've done a couple of cases like this in the past. So I extended it from the medial thigh lift. She was prone, and I went up the buttock just at the edge of her bathing suit line. And I took out a wedge of tissue and I closed it. And I got rid of all the wrinkling, and it's a little tight now, but it's starting to relax. But it essentially solved the problem. And I've done this case a few times in the past, but this is what these old school plastic surgeons used to do in the pre-lipo era.
Where is the incision?
So I don't have,
It basically ends up in the infragluteal crease, though, right?
Can you see my arrow up here now or no?
No.
I have to share my screen. But,
and I'm sure yours is going to turn out fantastically, but I've seen some of the older guys that you're talking about in the result, and it can be challenging for the patient to cover up.
It's pretty easy, but if you wear a full bikini underwear or bathing suit, you cover it.
If they wear a dress from their neck to their ankles, everything.
No, it actually looks good. It's not a buttock crease incision. The incision comes up the bathing suit line, and I'll draw it out so you guys can see it. But what I should have done is I should have just shown the drawings on here. But it's so I use an excisional approach. I'm interested to see in the future some of the things that Dan was talking about, because we try to use some cadaver fat for this, but they didn't have the volume of cadaver fat that we're able to get from the cadavers to fill a buttock yet. So, Dan, when do you think these new products these synthetic products are coming out?
Earliest would be a year from now. First in man studies are being done right now.
Oh, very cool. All right. So I'll show you the before and after sometime, and I'll share what I've accomplished with an old school excisional buttock lift. But thank you, Kurt Wagner, who's now dead, but he showed me that years ago, and that's what they did in the 70s. So let's go to our two cases now that were two stories that we're talking about on No Spin. So the first one is a story about Florida once again, where I practice and Dan has a license, where many of the physicians, including myself, go bare and don't have malpractice coverage. So this is an article about some patients that were injured and they couldn't really get any compensation back from the plastic surgeons because they had no malpractice coverage. So why don't you comment on that, Dustin?
It's interesting. I have several thoughts about this. You know better than anybody, Florida's the Wild West, and they do have a problem with people, unlicensed people, untrained people doing a lot of stuff there. At least it seems in the news that seems to be the case. But as far as the malpractice, it's like it's a vicious circle. This is a problem that was invented by lawyers. So doctors originally just practiced medicine, and then in order to protect themselves from attorneys, if the patient sued them for a lot of money so they wouldn't go broke, they bought malpractice insurance. But that has actually incentivized people to sue doctors more. So doctors have gone the other way and said, well, I will just take the risk. And then that de-incentivizes the lawyers to sue, and it leaves the patients, ultimately, who we all ought to be looking after. They're the ones that are kind of out in the wind because what that article really said is lawyers won't sue if can't make millions of dollars.
Pretty good.
And that's the problem.
What about you, Dan? What do you think of this?
Well, there are two problems. One is Florida doesn't mandate malpractice. So physicians are judgment. They have no money on the books, and you can't sue them for malpractice. The second issue relates to paying for hospitalization. This patient had options to have, Cosmetasure, post-op complication insurance that they didn't take. I think plastic surgery is a risk that you take. So I think
let's go into one of the stories. One of the complications was the liposuction surgeon got into the abdomen and caused some necrosis and had some bad scarring, and the patient was in the hospital for a while because of an infection.
Right. So that's two litigations. One is malpractice. The other one is who's going to pay for my post-op hospitalization. And taking the second point first, I don't care what state you're in. I don't care what planet you're in. You have plastic surgery and make all the assumptions about informed consent. And I think it's the patient's responsibility to pay for their complications if they have them. And I think that the second is a malpractice question, but abdominal misadventure and liposuction is a known complication. Is it defensible? Not likely. It's probably in a malpractice world, it's a case that's settled. In a malpractice case where there's no insurance and no money, the patient's stuck.
It's a tough situation because I live in Florida. I see both sides of the story. The problem is, or the good thing is, not carrying malpractice insurance got rid of frivolous lawsuits. Because if you don't have insurance, the attorneys are not going to take on a case unless it's going to be a big dollar item case. They're not going to go after a scar that you don't like because they have to put money in the case, and the risk-reward ratio is not with the attorney. But you are required to settle cases up to $250,000 in the state of Florida. But this article talks about, well, if you go bankrupt, you don't have to pay that. Well, really, no one wants to go bankrupt. So I think, listen, most of the surgeons I know that don't work at these crazy clinics, they are dedicated, hardworking professionals that take good care of their patients and will do anything to ensure a good result. So the problem is a lot of attorneys out there who are just looking for these frivolous cases, but I think that this whole malpractice thing, or lack of it in Florida, kind of even the playing field a little bit because they're only going after more significant cases. So kind of between a rock and a hard place. And if you do have health insurance, it will cover most of your hospitalization if you have an abdominal issue like an intra-abdominal misadventure. All right, let's look at this second article, which is a little more interesting. It's about the Instagram face, talking about how all the people on Instagram look alike. So I'm not sure about that. But Dan, what do you think about the Instagram face?
Well, the Instagram story is too long to talk about in a talk show like this, but I think in 30 seconds I can say this. Instagram is an evolving medium where fashion and trends start to pick up and people follow leaders. And what we see today as the Instagram face will be something else a year from now. It's rapid. What sold on Instagram 6 months ago isn't selling today. All the algorithms change, and our vision of what's attractive and sexy and likable changes. So I think this is nothing more than a manifestation of Instagram.
Yeah, I couldn't agree more. And Dan really hit on the point that anybody who tries to work with Instagram knows it's a constant moving target, just like the content is a constant moving target. And I don't think that everybody on Instagram looks the same. And Dan also hit on that people will follow a leader, and so they see a look they like that's trending now. Everyone goes for that. The problem I think that the article is pointing out is that oftentimes they'll do it surgically, and then you're stuck with last year's Instagram look. So
you remember last year with the lips? Everyone had big lips on Instagram, then the lips went down. So I haven't seen any big lips. Now it seems to be big cheeks that they like. No, and the thing is,
well, and the same thing goes for not just the Instagram face, but the Instagram body. You know, the Kardashians have spawned our great interest in buttock augmentation and big butts, and who knows what that will be 5 years from now, 10 years from now. But that's the way it's always been. It's just Instagram lets us see it day in and day out.
Dan, are you still seeing a lot of the butts on Instagram as a big attractive point for bringing in patients? Are they still looking at
Oh,
it?
absolutely. I mean, Dustin is 100% correct. It's not just the Instagram face, it's the Instagram body. It's the Instagram surgery. What people are coming into my office and hitting me up on are two things that are completely driven by Instagram. One is buccal defatting, which I thought was like an obsolete operation, and an operation that, people shouldn't do because later in life they look gaunt. And lip lifting. Lip lifting is completely, hyped up because of Instagram. I have people calling me up about shortening their upper lip. Nobody is promoting those two operations in plastic surgery worlds, but in Instagram, it seems to be really hot. Have you guys seen that?
No. I actually did a little lip lift today, but more of a wear revision. But
I like doing the lip lift, but I don't like doing buccal fat removal.
Yeah. I mean, buccal fat's like, I used to do way more.
I get specific questions from patients like, do you do buccal fat removal? I'm like, how do they even know what that is, except that they're seeing it on social media?
We used to, but this was like 15 years ago. We did tons of buckle fat.
I know, but now it's back.
We haven't done much. Now it's back. It's not the best, unless you got chubby cheeks. It's not the best operation.
100% agree.
Yeah, all this crazy stuff, And the bottom line is like, I look at the butts on Instagram for Dan. But Dan is a very experienced plastic surgeon. He gives lectures out this. I mean, if you ask me who's one of the top butt injection guys in the world, I would look at Dan. But my fault with Instagram is that some of these Instagram physicians are not experts in anything except being on Instagram. And then patients are coming to them and maybe potentially having problems because they don't have the surgical skill set to, as well as their Instagram skill set.
Well, but isn't that just 20 years later after the plastic surgeon who buys a $10,000 full Yellow Page ad?
Yeah.
And when you're in the Yellow Pages, you say to yourself, well, this guy must be the best because he has the full page ad. I think that it's just electronic. We've gone from paper manipulation to electronic manipulation. The patients don't have the ability to determine who's good and who isn't. So I don't see it as anything else but
you know what?
And it's still in the print media as well. Like you get on the airplane and look at the back.
Yeah.
You're like, best plastic surgeon in the United States. I'm like, who is that?
Yeah, what's the take-home point? I mean, the take-home point is do your homework. Just because they're on Instagram and have a couple of nice pictures doesn't make them the expert of the world in that. Do your homework. Any closing comments from you guys?
Be yourself. Don't try to be like everybody else.
Yeah. If you'd like more information or want to see some additional videos, visit www.theplasticsurgerychannel.com.